joint. It is the largest and most complex joint. It is condylar synovial joint. Since the meniscus divides the joint cavity, it is an example for complex synovial joint. Bones forming the joint. Knee joint is formed by condyles of femur, patella, condyles of tibia. Knee joint includes medial femorotibial joint and lateral femorotibial joints and femoropatellar joint. Ligaments of knee joint. Fibrous capsule, ligamentum patellae, tibial collateral ligament, fibular collateral ligament, oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, transverse ligament. Fibrous capsule. Capsule is thin and deficient anteriorly because it is replaced by the quadriceps femoris, patella, and ligamentum patellae. Attachments. Superiorly, it is attached about 1 centimeter beyond the articular margins of femur. It is deficient in the anterior aspect. Laterally, it encloses the origin of popliteus muscle. Inferiorly, it is attached about 1 centimeter beyond the articular margins of tibia. Behind the lateral condyle, the capsule presents a gap for the passage of tendon of popliteus. Fibrous capsule is attached to the periphery of the meniscus. Part of the capsule between the meniscus and tibia is known as coronary ligament. Ligamentum patellae. Tendon of quadriceps femoris continues in the central part as ligamentum patellae. On medial and lateral ends, it continues as medial patellar retinaculum and lateral patellar retinaculum. It is attached above to the margins and apex of patella and below to the upper part of tibial tuberosity. It is related to superficial intrapatellar bursae and deep intrapatellar bursae. Tibial or collateral ligament. Tibial collateral ligament is attached above to the medial epicondyle of femur. Inferiorly, it splits into superficial part and deep parts. Superficial part is attached to the medial border and posterior part of medial surface of shaft of tibia. It is crossed by tendons of the sartorius, gracilis, and semitendinosus. Deep part blends with the capsule, medial meniscus, and inserts into the groove for semimembranosus. Morphologically, tibial collateral ligament represents the degenerated tendon of the adductor magnus muscle. Fibular or lateral collateral ligament. It is cord-like ligament. It extends from the lateral epicondyle of femur, just above the popliteal groove, to the head of the fibula. It is separated from the lateral meniscus by the popliteus tendon. Morphologically, fibular collateral ligament represents the femoral attachment of peroneus longus. Oblique popliteal ligament. It is an expansion of the semimembranosus tendon. It passes upwards and laterally from the groove for semimembranosus over tibia and is attached to the intercondylar line and lateral condyle of femur. It is pierced by the middle genicular vessels and nerves, and the terminal part of posterior division of obturator nerve. It forms the floor of the popliteal fossa. Arcuate popliteal ligament. It extends from the head of fibula, arches over the tendon of popliteus to the posterior border of intercondylar area of tibia. Anterior cruciate ligament. It begins from anterior part of intercondylar area of tibia, passes upwards, backwards and laterally, and is attached to the posterior part of medial surface of lateral condyle of femur. It becomes stout during extension of knee. It prevents hyperextension. Posterior cruciate ligament. It begins from posterior part of intercondylar area of tibia, passes upwards, forwards and medially, and is attached to the anterior part of lateral surface of medial condyle of femur. It becomes stout during flexion of knee. It prevents hyperflexion. Both cruciate ligaments forms a bond between tibia and femur and maintains the anterior-posterior stability of knee joint. Menisci. These are also called semilunar cartilages. They are made up of fibrocartilage. They are half-moon or crescent-shaped. They deepen the articular surfaces of tibia, and they partially divide the joint cavity into upper and lower compartments. Flexion and extension takes place in upper compartment. Rotation takes place in lower compartment. Each meniscus presents two ends, anterior and posterior ends. These are attached to the tibia and are also called horns. Two borders. Outer border is thick, convex. Inner border is thin, concave. Two surfaces. Upper surface is concave and articulates with femur. The lower surface is flat and rests on the tibial condyle. Medial meniscus is semicircular, wider behind than in front. The peripheral margin of the medial meniscus is adherent to the deep part of the tibial collateral ligament. Lateral meniscus is nearly circular. Posterior end of meniscus is attached to the medial condyle of femur through meniscofemoral ligaments. Tendon of the popliteus and capsule separate the lateral meniscus from fibular collateral ligament. Few fibers of popliteus tendon is attached to the lateral meniscus. The peripheral part of the meniscus are vascular, whereas the inner part is avascular and is nourished by synovial fluid. Functions of menisci makes the articular surfaces more congruent. They act as shock absorbers. They help in lubricating the joint cavity. Proprioceptive function. Transverse ligament. It connects the anterior ends of medial and lateral menisci. Bursae around knee joint. There are about 12 bursae around knee joint. Anteriorly, subcutaneous prepatellar bursa. Subcutaneous infrapatellar bursa. Deep infrapatellar bursa. Suprapatellar bursa. Laterally, bursa deep to lateral head of gastrocnemius. Bursa between fibular collateral ligament and biceps femoris. Bursa between fibular collateral ligament and popliteus tendon. Bursa between popliteus tendon and lateral condyle of tibia. Medially, bursa deep to medial head of gastrocnemius. Bursa deep to tibial collateral ligament. Bursa deep to semimembranosus. Anserine bursa. It separates the tendon of sartorius, gracilis, and semitendinosus from one another, from the tibia and from tibial collateral ligament. Relations of knee joint. Anteriorly, the knee joint is related to ligamentum patellae, patellar plexus of nerves, and anterior bursae. Posteriorly, the knee joint is related to popliteal vessels, tibial nerve, lateral head of gastrocnemius, plantaris, and common peroneal nerve posterolaterally. Medial head of gastrocnemius, semitendinosus, semimembranosus, gracilis, popliteus posteromedially. Medially, the knee joint is related to sartorius, gracilis, semitendinosus, semimembranosus. Great saphenous vein, saphenous nerve. Laterally, the knee joint is related to biceps femoris, origin of popliteus. Movements. Flexion and extension. These movements take place in the upper compartment of joint, that is, the meniscofemoral joint. The flexion and extension movement takes place around transverse axis. But this transverse axis is not fixed. The axis moves backwards and downwards in flexion, forwards and upwards in extension. Rotatory movements. It takes place around vertical axis. The movement occurs in the lower meniscotibial joint. Rotatory movements occur independently in partially flexed knee or adjunct rotations. It also occurs during the flexion and extension movements as conjunct rotations. Locking and unlocking mechanism of knee joint. Locking is a mechanism that allows the knee to remain in position of full extension. This helps to stand for longer duration without much muscular fatigue. During extension, the lateral femoral condyle comes in contact with the lateral. At this point, still 30 degrees of extension is pending. At this stage, the lateral condyle serves as an axis around which the medial condyle of femur rotates backwards. This final medial rotation of femur on tibia helps in completion of extension. This movement will lock the knee joint. Locking is produced by vastus medialis. In locked knee, all ligaments of joint are taut except the ligamentum patellae. Flexion of locked knee begins only after it is unlocked by the reverse movement, that is, medial rotation of femur on tibia. Unlocking is produced by contraction of popliteus muscle. Muscles producing the movements. Flexion. Biceps femoris. Semitendinosus. Semimembranosus. Extension. Quadriceps femoris muscle. Locking muscle. Vastus medialis. Unlocking muscle. Popliteus. Medial rotation of flexed leg. Popliteus. Semitendinosus. Semimembranosus. Lateral rotation of flexed leg. Biceps femoris. Blood supply. Knee joint is supplied by 5 genicular branches of the popliteal artery. Descending genicular branch of the femoral artery. Descending branch of lateral circumflex femoral artery. Recurrent branches of anterior tibial artery. Circumflex fibular branch of the posterior tibial artery. Nerve supply. Femoral nerve through nerve to vastus medialis. Genicular branches of tibial and common peroneal nerve. Posterior division of obturator nerve.